and share the screen. So this is the presentation. So the biggest question that I want to ask for everyone is, what if you could predict your quality of life down the road? That's the question that I'll pose to everybody here, but also I pose it to even our patients. One of the stats that we'll talk about in a minute, we were sitting in a presentation or in a training. We had to go through a week-long training about a month ago, and one of the statistics, or this kept going research after research article about certain measurements within the spine. And so, but the week before COVID hit, we had been down and did a evaluation of the employees at one of the dental offices here in Rapid City. And all I could sit there was sitting thinking about them and being like, all right, what are we gonna do? What do we have to do? So this is part of it. And we are going to start into here. So my name is Dr. Bob McIntosh. I am at Health Source Chiropractic. Next one, oh man, this is gonna be so confusing.
Yeah, for you.
Yeah. And so this is what I do when I'm not working, is I get to hang out with my kids. I have two girls, a 7-year-old and a 10-year-old. And I have an old car that my dad gave me, and I've had it for 22 years, and I finally redid it here. And so I used to be a cheerleader for the Red Dogs here in Rapid City. And let's see, look at you, oh, you got this. And so this presentation we've been going through as far as compiling the data. We've all been involved. So this is Dr. Elise in the back. Say hi, guys. And so Dr. Zach's my partner in the office, and Dr. Elise is our intern, and she's graduating here in a month. It's crazy. Dr. Allison, and so Dr. Allison graduated well, and I said, here's all the information you did, and she made PowerPoint pretty for us. So thank you. That's a good idea. So the presentation title is Kyphosis, the Dental Professionals Pandemic. Is that fitting or what? And so this is the overview of the presentation. And I'll talk about the definition and the forces that are involved in the scenario of kyphosis. And with the cervical, thoracic, and lumbar spine, we're gonna stay focused in one area, because I think if we stay focused on one thing, we'll be able to understand it much better, and we'll be able to think about our environment with that, in that scenario, much easier too. Dental professionals, every one of them, dentists, assistants, hygienists, they have a high risk of musculoskeletal disorders because of the ergonomic challenges that they have and that they're in every day. And it takes an active effort to be able to counteract them. And who here's been a hygienist over 10 years? 3, 4, 5. So good job. And this is, as far as doing this presentation, it was, I asked, hey, can we get this data put together? They're like, yeah, get a hold of the association. We can start doing this. So that's why we're here. One of the other things that we'll talk about is ASD. And this was the one that woke up made my awareness on basically on this topic. And so we'll talk about that one of the slides. Next one is going to be kyphosis and quantifying it, and we'll put it in categories of like normal, mild, moderate, severe. So everybody like goes up, measures gums like 1, 2, 3. What's the numbers? Is that it? That's a 1. Oh, oh no. And so we'll show you how to quantify this as well and measure things objectively. We're going to talk about posture screen and posture array, different ways to do that. And then we're going to talk about questionnaires and then also assessments like range of motion and normals versus hygienists. And this is current local data from Rapid City. And the next two are going to be about mobility, general work, and then something called WebEx. And then I'm going to ask, as far as at the end, for help from everybody. So, what is dental hygiene? This was from the presentation that we gave in February. Habits and practices that are conducted to improving the health of the teeth and the gums. Gingivitis can be cleared up by good dental hygiene. Okay, got that off the interweb. What we started talking about, because I'm talking to the hygienist about what's the equivalence, what's the, as far as if a person doesn't move very well or their spine doesn't move very well, it's the equivalent to building up calculus on your teeth, building it up on your spine, preventing you from doing the motions that your spine should be able to do. And, but it doesn't happen fast. It occurs little by little over time. And so that's these two situations. This happens to be a human normally for you guys. Anything over 40 degrees of bending ends up being a bad scenario for the spine. And so that's what we're going to talk about today. So what's the number?
40.
Okay. All right. So kyphosis, what is it? The thoracic spine or upper back is a normal outward curvature that the health care providers call kyphosis or a kyphotic curvature. And so this medical term is an abnormal forward curvature of the thoracic spine. It's actually called hyperkyphosis. We're just going to call it kyphosis for now, okay? But we'll talk about these degrees. So the favorite number of 40. We'll talk about that 40 mark, and then we'll assess this through x-ray. So, and it's really hard to see the top two, so you go down a couple of segments, and it's actually 37 is going to be the number that we'll talk a lot about. So 45 is mild kyphosis. 50 is moderate to severe kyphosis. And then at 60 degrees, it's something called ASD. So understanding kyphosis and the forces that are involved, as a person shifts their head forward, you can agree that that adds force or weight onto the middle back and the low back. And so what happens, for every inch you move your head forward, it adds another 10 pounds. So we're going to take, and that's what we're going to talk about in this whole situation, is in your normal working situation, outreaching, you're over a 40-degree kyphosis in your workstation for a dental professional. So what is ASD? It's an adult spinal deformity, and you have to fall into a category, in one of the 4 categories, okay? Is everybody here over 18? Yes or yes? Okay. And the other thing is that they'll have a sagittal vertical axis change of more than 5 centimeters. And so that means that they'll have they're listing forward, and that ends up putting them to where they're holding their head forward and puts more weight on their mid back, low back, and then so you can measure those on X-ray. You can do some of it through posture pictures, and then we'll talk about pelvic tilt. It's less than if the spine is if it's tilted up, or the angle is less than 30 degrees if they don't have any curve in their low back, so their low back is really straight. We're not going to worry about those. We're going to really worry about this puppy right here, the thoracic kyphosis. So this is when we started talking about research data on thoracic kyphosis. They measured within 8 countries, and they measured these people with this quality of life questionnaire called an SF-36, and there happens to be 36 questions, and it's their shorter form. You didn't want the other one. So they took this and they assessed all the people with ASD and compared them to rheumatoid arthritis, chronic lung disease, diabetes, and congestive heart failure. They had worse quality of life with a person with ASD than they did with rheumatoid arthritis, chronic lung disease, diabetes, and congestive heart failure. So, wow. We start to think about all the things that it impacts when a person starts tipping forward and losing their normal alignment. this normal alignment puts us at risk. The abnormal alignment puts us at risk. And so we did record that, right? I have to start all over. No, I'm just kidding. Yeah. So all these situations, everybody can like, I would guess, identify with these: long duration, repetitive motion, constant pinch, and the tools, some vibrate less, fancier, less fancy. And then it's stressful because you guys really are on high production levels. And so you want to be able to work hard and stay productive, both for you and the office, the health of the office too. This was just Googling the dental profession and looking at some of the data that was out there about musculoskeletal pain and injuries that are out there. And it talked about the degrees that we're talking about exactly the same way today. I'm like, wow, this is a thing. So this happens to be one situation, and this happens to be the other. Who here sits like this all the time? Who here is maybe closer to this, the one on the left? There's an ideal situation and there's not so ideal, right? And I think we all fall into this scenario, and it's being able to help our body. If we give it a dose of X on the left, that dose needs to be counteracted with what? Okay, that's our job today. Kyphosis being in excess can cause back pain, shoulder pain, neck pain. It causes a reduction in function or impairments in objective measurements as well. Motion, range of motion, strength, pinch and grip, and it's kind of important things for you guys like dexterity. And so these are hugely important topics. The next couple, they're like a step away, because when something hurts, you want it to go away now, right? But there's other quality of life outcomes like sleep and even sickness or illness, being able to have improved lung capacity. As a person has increased kyphosis or too much straight spine, not enough kyphosis, they'll actually have reduced lung capacity. And in people with too much straight spine, they'll actually have, it'll be a restriction on their heart, and they can't get their heart to be able to, like they'll show up with abnormal EKGs, those types of things as well. And so that was another thing I was like, wow, this is like more important than I ever expected. As a person increases in their deformity of kyphosis, they'll end up creating more damage to the discs or the cushions in the spine. And so it just increases the wear because of the forces in them. So this low back, middle back, neck. If the neck gets bent forward, most of the time their problems are a lower neck, upper back, and low back, okay? Or at their shoulder blades, they'll talk about it, but it's really a cause up here. So then we'll have, as people get older, they'll have increased risk of vertebral fracture. So as they start leaning forward, grandma's leaning further and further forward, she falls and lands on her butt, smashes a vertebra, end up with a compression fracture. And this happens not just for grandma. This is people with increased kyphosis. They're at higher risk for this as well. And if we look, this is the hard one, but this is the big picture. It actually shortens our lifespan. So we have to start with this. So we're gonna do some interactive fun stuff today, but the interactive fun stuff is really gonna be on our next presentation. So we're gonna teach you guys a ton when you come back in 4 weeks, okay? And it'll be the week of Thanksgiving on Thursday. No, I'm just kidding. We'll probably do it the week after. But we're gonna take today and show you guys how assessments occur, okay? And how we can measure those items. And so, Dr. Elise, would you grab the posture screen and let's go ahead and do this. Who wants to be the volunteer? So in order to be a volunteer, I do want to be able to do an X-ray on you. So whoever would like to, I will do the thoracic X-ray. Okay?
Sounds like we're doing it now.
Yes. Do you want to do it later?
I don't know. I'm not sure what I'm gonna.
I'm gonna have you put your information in here. So this is really important. So we put your name, last name, your date of birth, your weight, your height, and then make sure to put your email address.
Okay.
And what'll happen is we'll take these 4 pictures, and then we're gonna take the 4 pictures right now, and then we're gonna take those 4 pictures, and there'll be an assessment. We'll go through and change up the lines.
Okay.
But while we're getting our picture, I want everybody else to watch it too, because it's super new, cool, fun technology.
Are you wanting to do it up here so we have
Yes, that's a good spot. I like that.
that way everyone
So posture screen takes pictures of the person standing, and then we will take those pictures and it'll help plot points. So go ahead and let's have you stand right there facing us. Take your shoes off too. And then
Very
Sure.
good.
sure, it's good. So everybody get in a line and take a look right here. This is super neat.
You're so excited. Oh, yeah.
So let's see you do that. So it plots the points in posture in it. So when we plot these points properly, we can calculate the weight. And it'll do the same for each side, and then with your back facing us as well. So we'll go through that and do posture screen, and we'll get to see the fancy report afterwards. Then on our next, so this is the example. You'll take the 4 photos, and then you have to make sure and wear tight-fitting clothing because the points are really important. You go off the side of the torso, go off the top of the shoulders, you'll go off the ears from the backside, you'll do the eyes, right here, but what's this spot called? And then, what is it called? Your lip. So, and this will give us a report similar to this. And then it'll tell us, so we have to tune them up and just kind of move it, like move it so it's because your pupil will be over here, we'll move it right here on the screen. Okay. So we have to fine tune it. So once we do the posture screen like this, then we'll take an X-ray, and we'll take and have you just sign all over these in there as well. And then we'll take and be able to measure the curve in your middle back with that too. So, and the funny thing is, good posture on the outside has nothing to do with the structure of the spine, because it's crazy deceiving. And let's go one more. Thank you. So this person overall has pretty darn good posture. Their ear is still over their shoulders. This curve is good and bears weight on the facets and the discs the way it should be. This person is facing this way, and they have a buckle in their spine, and their disc between 5 and 6 and 6 and 7 is almost gone, like 80% gone. But they appear to have good posture. They won't have good mobility, and they won't have on their picture they'll show good posture. But when we take the X-ray, so we'll see who's telling the truth. Okay. So, and then once we do all this, there's going to be some questionnaires that I'll have you do. The questionnaires are going to be a neck disability, a low back disability index, and then there's going to be the SF-36 that I'll have you sit down on the computer and do. And with that, we'll be able to take all that data and take a snapshot of who you are now. And that's like your snapshot in time. And these are what they look like. And they score a person where they have discomfort, those types of things. And then so we collected data. We'll just say we collected yours right now while you're doing all this. So this is the report. And I'm gonna go to her front photo. So she has a right translation of her cervical spine. Her right shoulder is lower, and her thoracic and her pelvis and her feet appear to be pretty normal. Stands with decent posture there, but she translates her head. Right. So what I'll ask you this, and this is probably a loaded question because I don't know.
Yeah.
When you are working, which way do you tilt your head and lay down with patients?
I don't know. I feel like it's towards left.
But do you translate this way and settle into it and translate your torso, but your head tips?
I don't know.
Think about it. So that's we have to start thinking more about this, and the more that we become fine-tuned on your profession,
Sure.
the more that we get to know, just like that calculus word.
Right.
No clue.
Yeah.
This is the other one. This is your ear and your shoulder, and you have anterior head translation, so your ear hole is further forward than your center of gravity by a couple inches. So we will go back to your report now. Oh, I should.
Never did ask if they could hear you. No one said anything.
I muted them all.
Oh. But they could raise their hand.
Let's see. I'm gonna put everybody on pause. All right. Can everybody hear us? We forgot to do a sound check.
Yes.
Okay. Abby's report. So Abby, your head, based on your body weight, and your head is supposed to weigh 10.6 pounds.
It's probably heavier.
Okay? She's funny. So it's supposed to weigh about 10.6 pounds, and with her head translated forward by 1.72 inches, it weighs 29.2 pounds instead. So there's proof. Because of leverage, your head weighs.
Yeah.
Okay. Had to put that out there. Now, here's the fun part. Is I'm going to send you an email with your posture screen in it. Okay, so Abby, it's in there.
Okay.
And then we're going to take with your posture screen, and there's one of the technologies I'll talk about in a minute, based on your postural distortions, to help you, okay, we can actually send customized exercises that are based in that software over to you to help you reduce that translation. Okay, so all right, so this is when we talk about data collected here locally.
This shoulder up a little higher.
So we have mobility and kyphosis that we tested at a dental office. And the yellow columns are their ranges of motion on the left-hand side. Right-hand side, the 24% loss there, that's low back. And then the right-hand side is going to be grip strength. So right side for these individuals was weaker than the left side, but it was only by a pound, but it still should be 20% stronger on their dominant side. So we'll track right-handed, left-handed, and you can find nerve irritations with this equipment that we utilize for pinch and grip testing, and it'll show up that a person's having weakness before they have an issue. And so Shivani is going to grab the equipment that does that. So she shows up and she'll test. We test like entire 200 employees at a time. We'll go through and test them, and then we'll take and show them the group data as a whole. So we did this for a group over 5 years. We tested them, and they had thoracic mobility loss, and their average age is 44 years old. They had a 54% loss, and over that 5-year time frame, they were able to get their range of motion was improved by 50%. So they kicked butt. So this is some equipment called JTEC, and I'm going to have you pinch this, and you'll do it. There's 3 ways. There's going to be pinch, pinch, and pinch. Okay, pick your favorite one.
Hey Bob,
Yeah.
we're gonna have people on the computer watching while you do it.
Okay.
And have you put your hand over so that
Which one?
this way.
Go back. I read it. This one, and then just stop sharing. So this is the equipment. This is a pinch gauge. This is a grip gauge. The other one's a range of motion gauge that I'll show everybody. So the pinch gauge, you can lean forward, show
I
them.
don't know that children will probably inside.
So
Oh,
we
relax.
won't worry about all those
Okay.
details.
Okay.
We're gonna just worry about a pinch. So you're gonna pinch that. So you're faking it right now. Curl the 3 fingers in. Yep. You get that one off of there. Just that finger. All right, buddies. Good. So, and what it'll do is it'll give us a computer readout, and it'll tell us compare left or right. Thank you. You're great. The next one's gonna be grip. So you'll hold it out in front, and you'll grip as hard as you can. You'll say harder, 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 and then let go, and then you'll switch sides, and you'll go back and forth. And this is where I was saying if you're right-handed or left-handed. So right-handed, you should be stronger on your right-hand side on your grip by up to 20%. And if we show less than that, we're showing some irritation along the nerve root or damage to the arm, muscles, those types of things. So that's some of the equipment, and that's how we got some of this data too. So back to the data, and you can get your X-ray. Yep,
Okay.
I'll go over this with you.
Oh, okay.
So I'm in the red, up at the top here, we have 44.8 degree kyphosis. And that's with external measurements, non-X-ray. So it's not gonna be as accurate. It's just a good guesstimate for pilot studies. And so on this, we have thoracic kyphosis for these 5 individuals, 44, 31, 58, 51, and 40. And oh, look at that.
Who was 58?
The youngest person.
Thank God.
So so what happens is we look at these numbers, the average of the group, and the individual gets their report as well, but the average of the group gets to go, oh, okay? So this is that warning time of what is ideal, what's not ideal. And so in this, let's see, we put this in here. It's always the cliche, you must take care of yourself so you can take care of everybody else around you. I mean, as moms and dads, we have to take care of ourselves, but we're always like, yeah, right, it's the kids. But here's this data. This is a infographic, but it talks about the general public believes as they get older, right, their range of motion and their strength decreases. If they measure it and they understand how to impact it, they can change from where they're at in that 20, 30, 40 years old, 50, 60 years old, whatever your age, sorry. We'll take and improve as much as we can, okay? Or at minimum, maintain it, because it is completely possible. In fact, the reason why this all came up was this guy, Tom, he was the CEO of the company. He started at 55 and he retired over here, but he started with his neck mobility at 41 degrees. And by the time he retired, he had 50 degrees now because he started implementing stretching routines, working, and put his health at a higher priority. And I will say, like, just because of this, as far as this data came from an occupational health group, but one of the tools that he implemented for the entire workforce was chiropractic. And so this person was able to increase their mobility in their neck. Their low back went from 12 degrees of back bending to 25 degrees. And then their strength went from 43 degrees, lifting from the waist, to 54 degrees. And then the bottom one's also another increase by quite a bit. But they were able to increase their health and mobility and also their strength over time. So this guy's ready to retire, and now he's healthier and stronger than he was before. So the question with today's presentation is, can kyphosis change? I will tell you, just working on spines for the last 10 years, thoracic rib cage problems are the hardest to deal with. If I ask, is there a tooth that's the hardest to deal with, which one is it? There's got to be one. All of them? Okay, all right.
Yeah.
So in the spine, the neck it's available to get worked on because it's mobile and there's not a supporting structure like ribs. The low back is just bigger bones, and so they're more stable as well. The thoracic spine has these outriggers that are built on the rib cage, and so what happens with that is it creates stability for them. And so to change the mobility or to change the shape of that thoracic spine, it takes considerable effort. We're gonna do this and pull up the data and say, all right, we're gonna go mobility. If we just do exercises and we're doing these things more than 3 times a week, they're gonna look like this. On the right hand side, you'll see bird dog exercises, Superman exercises, postural translation exercises, and then ball exercises. The data shows right now that you can only change the thoracic kyphosis by 3 degrees. That's less than 10%. So then the other question is, if we have to implement another procedure, so real quick, this one, there's 2 ways to change kyphosis in movement for the human: mobility or through traction items. And so mobility exercises, they can only improve thoracic kyphosis, or reduce it or improve the mobility by 3 degrees. Okay, so this is also another tool that we utilize a lot, is foam rolling, cross balls. And if you don't do it, you really should start yesterday. When?
Yesterday.
Okay, good. This is what these tools over here are used for. They change curvature of the spine. It's like putting braces on them, and you pull, push, twist, whatever you need to for the spine, but you can improve about up to 12 degrees. So when I say it's really hard to change a thoracic spine, like that's only 25% of the range of the kyphosis that would change. And so that it's more intensive. And as far as that's how you do it with traction. So the person's sitting in a chair, kind of a stool like I am right now, and they have a fulcrum in their mid. They have the lower and the upper spine pulled to create this, and they have to sit like that for 20 minutes in this. And you'll put 50, 100 pounds of force into that thoracic spine and hold them in that traction. And it, just so you know, it's not super painful. Like it really isn't. It's just awkward. But it's just, you have to hold them and sustain them in that position. That'll change the thoracic kyphosis, only up to 12 degrees. One of the cool things, there's a orthotic, this is a cervical one, that's a thoracic one. You can change the thoracic spine with some tools at home once you've identified it properly. Not just, oh, I think I have a rounded back. No, we have to measure it right, because you can cause damage. You have to know how and where to utilize. It's called a dinnerol, and it's gluten-free.
My kind of thing. It's the only thing I can eat here.
So, and this is like telling a patient to wear their night guard.
Or to floss.
Or to floss. And so this is a cervical neck dinnerol, and this is a thoracic for kyphosis. So you'll lay on this. This is a foam block, and it looks small and harmless, but when you start laying on it, you're like, wow, that's intense. It's intense enough they've made a trainer version without this big hump on the top. And so what happens is you'll place it on the apex of the thoracic spine on that kyphosis, and then they'll bend backwards over it. Okay, so let's do that. So you'll lay them like this, and one of the tests that I do when I'm working with the fire department or any groups, the businesses in town, so we'll take the foam roller, this guy, and we'll just have them lay on their back and then set their butt on the ground and their head on the ground. So you have to test if they have mobility in the first place. You'll see some people teeter-totter on it. They'll never be able to touch their head to the ground and their butt to the ground. Those people are a lot harder, and their dose is going to be a lot longer to be able to reduce their kyphosis. The people that are more mobile, they tend to be harder because they won't stay. They'll just bounce Gumby back into it and out of it. So you have to find just right. So it's like the porridge. So the curve, again, the thoracic spine, between this point and this point, you have 37 degrees in the middle back, 40 degrees in the top and the bottom. So if they're at 50 or 55 degrees, and this is people walk around with that 55 degree, and you'll notice it after me pointing it out today, right? You're like, ooh, they must be a dental hygienist. No. But so then you'll take them and you'll start working on them to try to get them to straighten out. So you'll take another x-ray after their first round or dose of care, and you'll see how they improve. So I'll continue on. Sit. Okay. So, and that improves up to 9 degrees. So this is the example. You'll lay on that dinner roll, and you'll find that apex of their thoracic spine, and you'll take and create that curve. Now, let's talk on the people with too straight of a spine. You can just move it higher and bend that and create the thoracic kyphosis that they need. Okay? Or you take the cervical one, place it in there, and you'll do these stressed x-rays where you bend the spine to where the ideal point is. You're like, that's your goal. Okay, and that's what you'll use the dinner roll for when you take and you'll place it in those same positions as far as to get the outcome that you're expecting. You'll do this starting it for a couple minutes every time. You'll add 2 minutes each dose each time that you use it, and your dose duration is 20 minutes. It's not all night long like an explain. So I honestly need help from every single person. And if the people that you're thinking about aren't here and they're at the office or they're at home and they wish they could have been here, I want everybody to be able to help us with this. And if you will, I promise to be able to put this all together into an actual research article, and we'll publish it. And we'll publish it with, so we went for that week-long basic certification. It's called chiropractic biophysics. And there is so much research out there right now. We went and got our basic certification, and it's very neat to walk in and tell someone you can actually fix their spine now, where in the past it's like, yeah, I think we can. And now it's our confidence level is just like another level higher, and then we can actually measure the outcomes, like how much better are they too. So it's super exciting, super fun. But CBP will help us publish this data, but we have to have a high enough number to show that the data is reproducible within a group. So we need 40 individuals to be able to do this. If you want to be able to be part of this, please come talk to us at the end of this, okay? There is cost in it, and the reason why is because of that cool software, the cool x-rays, the cool dinner rolls. Those things do cost, but we're going to put all of that into it and share that across the whole group, okay? And so the goal is to be able to have everybody say, hey, let's do this. If you guys want to, please let us know, okay? So I have this slide.
Oh, you're not just gonna walk away and give up.
Stuck.
You can get that. That's yours. Nobody else. Get in there. Give it some heat. Give it some heat. Give it some heat. Get in there. You get it. You go in there. That's the one right there. You get it. Yes. All right. Yeah, baby.
I was a cheerleader. Did everybody catch that? So in this, my big question is, all right, does everybody know their number? Are they at that 40-degree mark? Are they less than that 40-degree mark? If they're in the 45, the 50, or the 60-degree mark, we want to be able to help you understand how to deal with it. We will also teach you every bit of the exercises at the next presentation. The next presentation is completely free. You guys come to that one also, even if you're not in the research group, okay? We want you guys, and we feel it's that important that you guys learn this information. We're going to teach you how to use the foam rollers. We're going to teach you how to use the lacrosse balls. And then if you know your numbers, we'll teach you how to utilize the dinner rolls as well, okay? So the goal with this is to be able to say when a hygienist comes into their profession, if they know that they have a higher degree of their kyphosis or a low degree, they know where they need to head or work or to be able to make it better. And then it's just like having high blood pressure. You go to the doctor, oh, your blood pressure is high. They give them a blood pressure medication instead of telling them to exercise. So in this scenario, we're going to give you the number that you're going to be able to take and impact with mobility work and also with the general work too. So that's my presentation right now. We're going to go through and go to the x-rays. Were you guys able to get those digital? So you mind if we share with them? Okay. We'll let you guys go in there together and go over it as far as her results right now. And then you can invite us in if you would like.
Oh,
how's that sound?
that's fine. We can all go in.
Oh, okay. What's that? So we're gonna, this is with a thoracic x-ray. We're gonna take and go in the x-ray room and just talk about where the curvature is in the middle back and the kyphosis. So I'll bring you guys in there as well. So if you guys wanna go around.
Yeah, she's too, or hyper.
So would she like use a dinner roll then? Would that be the bill?
There's still, so we have to take into account the whole spine too. So there's a lower back, the knees, and neck up top, right? She increases, you see how she loses it at that like 11? That little 11 is way down at the bottom.
Okay.
12's tracking pretty good, and there's like a focal point there where it drops forward. So we could still pull her back at that point.
So what's her number right now?
34.
34?
Is
Okay.
she passing? Is she winning?
So the biggest thing is she's very close to having the 37 degrees in her kyphosis, but
Compared
she's
to the 37, T3 to T10, she's at 23.
oh, she is.
Yeah.
Okay, so she's at, so between the 3rd thoracic vertebra and the 10th thoracic vertebra, she's at what?
23.
23, and it should be at 37. So she's hypokyphotic, and being able to find where to place that is what we would end up doing to get the red lines. If you can take this up there and show them too. The thoracic spine are the red blocks, and then the green line is the ideal thoracic curvature. Now, what Dr. Zach was talking about, the lumbar spine and the cervical spine, they can pull and change the orientation as far as where that ellipse or that curve is actually tipping. So even though you're hypokyphotic, your upper back, so like your upper 7 thoracic vertebra are super straight. That's where your biggest loss is. So if it's actually going to be lowering your low back that needs to go forward, that would tip the upper part backwards, and then we need to curve the upper part forward. So that's how you work on that. That's a tough one. So you know, some people you'll find this acute more angle, and you're like, that's the spot you put the dinner roll.
Right.
Yours is very like it's diffuse as far as where the placement would be. It's actually, I would say you actually need a cervical dinner roll and a lumbar dinner roll to push the 2 points forward and let thoracic spine fall back. You know what I mean?
Yeah.
That type of thing. So, all right, cool. So, is it warm in there? Thank you, Abby.
Yes, thank you.
So, in this assessment, if we can line up the 40 individuals to do this, so I have Dr. Allison and Shivani, like they are mission impossible for the dental hygiene profession right now over the next 4 weeks. Okay, that is literally their job, to be able to gather all this data with everybody and put together this dental hygiene infographic human with either a mid back that's really rounded or super straight like Abby. And we'll take in that situation, and everybody would get their X-ray, they'd get their posture screen, they did all their questionnaires, their range of motion, their and then all their pinch and grip, and then the last part will be their pulmonary function test, because pulmonary function with too straight or too bent will run down lung volume. And so when we do all the fire department physicals, we have all this equipment here to be able to do that, and even it reduces a person's pulse ox as far as their oxygen O2 levels in their blood. There we go. And so we'll be able to do their pulmonary function test, and she has that little tester here. And then it gives us a little readout, tells us what your results are, and as a person improves it or changes it, their kyphosis, we can measure that and see their lung volume increasing. So as we get better lung volume, we have less risk of developing things like pneumonia and have improved lung volume to be able to run better or have more endurance, those types of things. So then once we have all this data over this next 4 weeks, super geeked out in front of the computer for a little bit, we're going to take every single person's their posture pictures, as long as they match up with what we see on that X-ray. We'll send over the web exercises to every single person, and then those exercises they'll be available on that platform for you for 6 months. And so you'll use that as far as and we'll just have to update them. The only reason they fall off is because we don't update them. So we just need to update them and see how things are going. But we're going to add on top of this and test everybody again at the end of 6 months. And you'll get to see what's changed and we'll also see the people that did and did not do it too. They wore the nice time. And so everything will be included as far as if you need a dental or a thoracic dental or cervical dental, whatever it is for that type of curve in your scenario, you won't get the thoracic dental for just the mid back, like I was saying, but both the other two. So, and then all your exercises, and then that class that we do in 4 weeks, we'll present all your data to you, okay? And then we'll take the data, teach you how to use the lacrosse balls, the foam rollers, and then the cool part, when you start doing the lacrosse balls and foam rollers, it takes away all the grid that's out, that migraine headache. Those things you're able to manage now, like significantly manage and take care of a lot of it on your own. So we don't want to, what happens through this entire thing, we want you to be empowered so you understand how to manage or how to take care of yourself when those situations happen. So this is the slide for WebEx. That was the exercise that we'll send to you as well. Shivani, let's see here. Where's the you have it? Can you pull them up and show Shivani's like what it sent over? Yeah, not the X-ray, the exercises. So if everybody would like to be able to do this, what we figured out is we can get it and do both of these evaluations for $150. Okay. But I have to ask that I have to be able to use your data, please. Okay. And then you guys will have access to it all individually. But nobody's going to know anybody else's results. Everybody will be held confidential, but the group data as a whole, one of the cool fun things we can do if we do a little prep, I won't promise at the 4-week mark, you can take your entire office as a whole and you can do little competitions and be like, we're the best thoracic kyphosis office in Rapid City or Gillette, Wyoming. There we go. But for real, this data, this information, if you really are serious about it, talk to Shivani. What we did is we set up an Eventbrite, and it's a link you just go to, just like sign up for a race or something, and you put your info in there, and then it'll process your payment, and then we'll set up a time for everybody to come here And if you really have a hard time getting away from the office, we'll come there and we'll do all the tests for everybody as well. So does anybody here know somebody outside of here that they're thinking about that could utilize this? That's important because I really want to make sure we hit that 40 point. So what else? Go ahead.
I'm just wondering, you know, because I'm closer to the Vermilion side, like how far, I mean, is it even something that you could make an appointment? Because I'd be interested in doing it. I just don't live anywhere near Rapid City.
I'm thinking, that's a great question. My goal, you know what? I think I'm gonna just say yes, because we can get you to go to a clinic where you're at. You can get your x-ray there. There's gonna be some of the data that you're not able to do because of the equipment. There's just very, very few clinics in the country that have it, like the pinch and grip and all that stuff. But if you can happen to get the pulmonary function, those types of things, we can utilize the data that you can get us, and the thoracic x-ray, you just can't be laying down, you have to be standing for it. And I'll talk to you specifically. Was it Tasha that asked the question? I'll talk to your doctor, whoever it is, to be able to get that picture too, okay? Is that right?
So if it's something that it only takes one appointment to do, then I'd be willing to travel.
Oh, okay. Then yes, for sure. More than happy. I was trying to think of the impossible.
You want an excuse to come to the hill.
You can come to the hills anytime you want.
Okay.
Anybody else? What's exciting about it? What's your biggest aha moment?
We could feel better. And then down the road, like, I will be able to walk. I won't be like this. Grandma. Exactly. I mean, that's always a positive as we get older.
Anybody else?
Knowing we like data. Hygienists just naturally like a lot of information, and just knowing what the heck's going on with our body. We know we feel like crap. We don't know really why, the details of it. So it'd be really interesting to know.
Cool.
Why not someone that cares
About
Hey.
too. Yeah, thanks.
care about our backs?
Because you guys care about everybody else.
Two is pretty easy. Like, it's not like you're asking us to do something really hard, like run. Like
Run a mile.
Yeah.
Cool.
And I have one of those.
You do?
Yeah,
Look
I
at you.
imagine in that.
Is it sitting next to your night split?
No, could we do it at Housesource in Gillette or?
So they won't have all the testing equipment. Like they'll be able to do the x-rays, just like I was saying in Sioux Falls.
Right.
We just, like, no kidding, we're just like super geeky and super sciencey here. And there's really not many people that are even certified to do like to recommend where to put the dinner rolls, those types of things. I think there is one clinic in Sioux Falls that does that. Then there's 2 clinics in Gillette that do this type of work as well. So, and I can get you in touch with them as well. So if we find something that we have to work on. So, yep. What else? You two are the quietest. I'm curious what's going through your head. Serious.
I've been through 2 car accidents,
Oh,
and so I've got spurs on my spine,
yeah.
right? And so when I went through the second car accident, we actually went through T4, and they singed the nerve.
Okay, so you had a rhizotomy. So they couldn't fix the injury to it, so they just cut the nerve so you can't feel it. For real, I mean, it helps the patient to be able to do the things that they want to do. So, wow. I'm curious. Super curious now. What else? Anybody else? Does anybody online have questions? So what I'll do is I'll have, because the time as far as being able to, oh, there's questions. Look at you. So on oh, okay, I'll respond to that one here in a minute. Okay, cool. Tasha's giving good feedback as far as for other places to send this to hygienists too. So thank you. So as far as on next presentation, what we will go over is again all the stuff that makes you feel better. That's the stuff that we'll talk and teach you about next time. And then the people that have been tested, they'll have more applicable information for their dinner rolls and placement on as far as where those will go to. So that is the conclusion for tonight's presentation. If you have questions, let me know. But Shivani, how do you want to send out the Eventbrite link? Do you want to email, like, or I can post it on here?
I mean, I can send it out to everyone
Okay.
via.
And so I'll
If that's
send.
okay with everyone.
Is that okay? So if everybody wants it, what I'll do is I'll send that link out, and then I'll keep you guys updated as far as what number we're at, as far as when it's 20, 30, 60, 100, whatever it ends up being. We'll take, and I'll just tell you guys where we're at for the total numbers, okay? So.
I do have another question. So is this just specifically for hygienists, or do you care if other like dental professionals get in on this as well? Assistants?
Does anybody in your office bend over a patient and work on their teeth?
Yeah.
Okay, so it truly
So
is.
everybody can use it.
Yeah, it's for all oral health professionals, whether it's assistants, dentists, or the hygienists. So, cool. Thank you guys. Appreciate it.
Thank you.